United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone.
Morning, morning.
Okay, we've got the agenda ahead of us. The first item on the agenda, the libraries, they have canceled out for today. So we'll take that one off. Is there any other additions, corrections, deletions? Okay, if not, we're in order for a motion to approve the agenda.
Move to approve the agenda with that deletion.
I'll second that.
Okay, got a motion and a second. Any other discussion? If not, we'll call for the vote. All in favor, say aye.
Aye.
All opposed, same sign. Motion carries. With that, the second thing is to approve the minutes from last week. Has everybody had a chance to review those?
Yep. Thought they looked very good. I didn't see anything in there that jumped out. That I make a motion that we approve the minutes.
I'll second that motion.
Okay, we got a motion and a second on the floor. Any other discussion? If not, we'll call for the vote. All in favor, say aye.
Aye.
All opposed, same sign. Motion carries. Okay, with that, we'll jump down to the second item on the agenda, which is the Fricky Building vacant office space Remax contract.
Oh, Monday, Janelle Lands contacted me and said that the agreement that we had with them has expired, so we either need to renew it or put out for bids again. And I recommend that we renew it again, renew our a listing agreement with them to have them try to rent it out. They've showed a few people, they haven't struck gold yet.
On that agreement, Neil, was it, how long a contract? was
6
it?
months.
Was 6 months? Do we want to stick with the 6 months at this point, or what do we want to do?
That's your recommendation, right?
Yeah, just
Okay.
renew the
What's it,
agreement.
is it costing us anything, or
No,
it doesn't
well-
cost us anything until they actually do something? Is that the
If they
deal?
rent it out, they will charge us, I think, $1,000.
Yeah.
That sounds right. Yeah, it was
Okay.
like equal to 1 month's rent or
Yeah,
close to that.
equivalent rate.
If that's a motion, I'll second that.
Yeah, it's a motion.
Okay, we got a motion on the floor and a second. Any other discussion? If not, we'll call for the vote. All in favor, say aye.
Aye.
All opposed, same sign. Motion carried.
Do you want to
Marty?
get in touch with her, or do you want me to?
I was gonna ask Marty if he would like to down sign it since he's the chairperson this year.
I can do that.
Yeah.
Just get a hold of Janelle.
Yeah.
Okay.
So, Janelle, sign it.
Okay, I can do that.
Is that okay with you?
That's totally fine with me, I just wanted to check.
Yeah, no, I can do that. Okay, with that, well, Mark, we haven't heard anything there. Dave's not here. With that, we'll go down to number 5. I bet we got a cancellation.
Dave was just asking if he should come up a little earlier, and I told him to go ahead, because.
Yeah, that'll work. Okay, with that, we'll drop down to number 5, is the canvas at Drain 23 election. Courtney, you got that in there?
Yeah, I do.
All
So,
10 votes.
yep, 10 votes. Looks like Scott Lenz was reelected to represent election district number 1. So, just need a motion to approve the canvas results and get signatures on that.
So,
I'll move.
Okay, got a motion on the floor. Need a second?
I'll second.
Okay, got a motion and a second to pass the Drain 23 election canvas. Any other discussion? Not, we'll call for the vote. All in favor, say aye.
Aye.
All opposed, same sign.
Should be a roll call. Is that what
Is it a
says?
resolution?
Is it a resolution?
Yeah, we do have a place on there for everybody's signature, so we'll go
Okay,
ahead and we'll
so-
do a roll call.
Okay, we'll do it as a resolution.
So-
Backtrack.
Yeah,
Yeah.
if we're
Yeah,
if we're
it's already
signing.
signed. They've
Yeah.
got mine made up ready, but you have to say yes.
Okay,
Okay,
Dancer,
Yes.
Ruggles.
Yes.
Shetler,
Yes.
Butler,
You gotta hold it hostage.
Miners.
Yes.
Motion
Throw it for a
carries.
loop.
We had extra
I
coffee
always
this morning or
forget that
something. Oops. Or making a new copy.
So everybody voted for the same person?
Yep.
I think that's what you call a rail.
And at what time was that election over? From
1
noon
to
till?
5.
1 to 5.
1 to 5?
You know, I was talking with a couple of the guys that were working it, and I think for another year, we need to do some checking and just see if we can have it up here in the courthouse and do it, you know, for a full month and just do it as an absentee and be done. It's kind of foolish to have 3 people sitting there just for 4 hours for 10 people to vote.
That good card game, huh?
Yeah. Pass the time.
Yeah, you about have to. Yeah, it's not a bad idea.
Is that a decision made by the,
About that time, be a good
by
game
law,
to
or
have.
is it a decision we can make?
It's by law.
Okay, so we really can't change anything?
We can't change anything. Can they change anything?
I don't know. It's in the code that it's that Saturday of every year. Based on the size of the drain, they have their own trustees, and that's in the code.
Must be the largest.
It could change if there's a
So we could change,
challenge
can we
to, you
change the
know.
size of it?
What's that?
I think we got
Change
big
the
results
size
when
of that drain.
one of the
No,
members was
no,
challenged
and
one
it's-
year.
And it's based off the landowners within the drain.
Well, you know, the thing about it is, though, I mean, if you still have the election, even if it's absentee,
I-
you know,
Yeah,
You
but
still-
you'd
it's
still
not-
have to, you'd still be
So-
required to have somebody there
on Saturday.
on
Oh,
Saturday
okay.
from 1 to 5.
They gotta have
Is it
three-
because the
they gotta
size
have
of drain
three
that they
people.
have trustees then?
Yeah.
Yeah,
Is that the only reason why?
Yes,
yeah.
Okay, 'cause that's the only one that has trustees.
correct. You guys are the trustees of the other drains.
Drainage districts.
I know that, I just never knew why there was a,
It's because of the
There we go.
size and the amount of value in the drain and how much they could actually raise
The levy.
to, yeah, they can generate a lot of
Who
income.
was it that was it? Scott Lynn?
Scott.
Scott
Lands.
Lands. And next year Dick Warren's up for election next year.
I think they've got a fund balance of like $200,000,
No, it's like 80.
Oh,
They've had a couple
that's
big
still
projects.
significant.
Yeah, they've had a couple big projects, but when they do have something
Yeah.
happen, it's
There's three
usually a pretty
trustees.
expensive deal.
Whoever Scott Lands, Dave Bauer, and Dick Warren.
who's the one?
Scott Lands, Dave Bauer, and Dick Warren are the three trustees.
As of, let's say, end of January 17. Good change there. As of the end of November, they had 157,000. And they have changed.
And they have a lot
Yeah.
of different, they have the
So I
main.
knew it
and
was
then
up
they
there,
have- Yeah,
you know.
they have the main and then they have a lot of laterals.
Tributaries?
Yeah.
The main, I think, had around 80 some in it, and then the other ones have.
I don't know if they got all the bills, if they had the Goose Lake lateral that they worked on this last year. They
Most
did
of that's
quite a bit
done,
of work
but I know
there,
they got
so
some other things
that
going
one's
because they
good again.
did a levy on, I think, Conley Pond. So they must be doing a project there too.
Mhm.
I think it was Conley Pond. I get them mixed up sometimes.
Well, is there anything we can do, the question Marty asked, is there anything we can do to change the election process?
I'd
According
talk
to the
John-
code, I don't
John
think so,
Warren
but
and see what we
yeah, I
can.
said, talk to John and see once. Maybe there is, maybe there isn't. I would assume there's probably not, just because I know this has been talked about every time we have one,
Yeah.
but maybe, you know what, maybe there is. Maybe other counties have approached it and handled it differently, I don't know.
It's a question for John for
Yep.
legally. Okay, with that,
So
we'll.
how many, just while we're at it, how many potential voters are in that district, you know?
The city of Carroll.
Well, yeah, the whole city of Carroll.
I mean, it starts at Breeden.
We only got 10 voters out of the whole world.
Yeah.
Like a
And
school
3 of
board.
them were absentees, so
Yeah.
that means
That's
only
worse than
7
school
people
board
showed
election.
up.
Yeah, but.
It's 300 pages, 300 pages of parcels. that
I know,
are
I.
Yeah.
A
but
lot. I
It is
couldn't
ridiculous
answer
to
that.
have people.
I think
that
10 is
long.
quite a bit, isn't it? 10 is quite a few, because I
10 is
remember
the
some
same
of
as the
them.
year before, and I think the year before that was 6 or 7.
Yeah,
So.
so I'm thinking.
It's never
that
been
could-
above 10 as long as I can
Yeah.
remember.
I think it's been half a 10 already.
And it would be nice if you could incorporate it in like your general election, but
You
being you
can't.
can't, because you don't have to be registered to vote in it.
Well, I'll bet you a majority of people don't realize they can vote.
Probably not. A lot of people don't even understand what it means to be in a drainage district either. You know, they just pay the tax.
Mhm.
But to get these Drain 23 trustees to get out there and educate the public, I'm sure they.
It's probably just as well to be left alone.
Well,
Sometimes we're better
if
off.
things are
Yeah,
going
poke the
smoothly,
bear.
that just means they're doing their job correctly. 'Cause we have
Careful what you ask for.
questions.
Yeah.
I think if things would change, if they have a problem or a challenge to
Oh, yeah.
incumbent, there'd be quite an increase in votes.
Because of the
So-
size of the drain, when they do an assessment, like the people in Carroll see a $5 bill, you know, a drain bill, so it's not very significant. It's
Street
your
light,
farmers
icon.
that see the big assessments, and they're gonna be the ones that are
Sure.
gonna be wondering what's going on. so.
Mhm.
you know, I think there's good stewardship there
Yeah.
as far as the trustees, if they did something that,
They must be doing a pretty good job.
They have a good board, they do.
yeah.
Since last night, too.
Yeah. Okay, with that, we'll jump down to item number 6 is the fiscal year 18 substance abuse semi-annual report, and that's in our packet.
This is the grant that, New Opportunities oversees for the county. We do this twice a year, semi-annual. So this is just the semi-annual. It doesn't really talk, I mean, it talks about all their goals and objectives, but it doesn't, I mean, there's really no money where it talks about money or anything like that. It just talks about what they are going to do to manage the plan and the program.
Have been any changes since the last 6 months?
No, the dollar amount for the grant was the same for fiscal 18 as it was in 17.
I think that grant's been the same forever.
It has
Yeah.
been, yeah, it has been.
How much is that? How much is that grant?
The grant is,
Like $3,500?
37 something,
Yeah, it's under $4,000.
Hardest part about this, as I recall, is signing it.
We
Yeah,
got that eliminated.
fixed.
It is if you change, yeah, if you change it,
Yeah.
change it,
Now
but
we
you
have
gotta have the chairman sign
Joanne
it.
authorized to sign.
Sign it.
Yeah,
Okay.
that makes it a little easier. except
Did
she's
you
not
realize
today.
if you're involved in enough stuff, you can't have enough emails to sign this paperwork? Cause if the government, if you got a.
Well, if you got a conflict of interest,
No,
oh,
for every document like this, you could have a different email.
To
So if you get involved in
electronically
different.
sign a state report, yeah.
So I've got 3 emails tied up with state stuff.
So Gene Miners at yahoo.1.2.3.
that'd be a pain,
It is a pain.
I remember.
especially the passwords.
You can just say that.
1, 2, 3.
No, no, Carroll.
So we just needed a motion to approve the report and authorize Joanne to sign.
I'll make that motion.
Okay, got a motion on the floor, we need a second.
Second.
Okay, motion and a second on the floor, any other discussion? If not, call for the vote, all in favor, say aye.
Aye.
All opposed, same sign?
Aye.
Okay, you abstain.
No, I'll vote, this is just a report,
Okay.
so I'll vote on this.
Okay.
If it was actually dollars involved, then I would've.
Dave's not here yet, is he?
No,
Okay, with that, we'll go down to committee reports. Rich, you wanna start off?
Yeah, I can. Last week, I didn't have anything. I went to ISAC on Wednesday and Thursday. Let me double check that. Because, yeah, my daycare meeting was Xed out. And then we did some couple budgetary things on Tuesday and Wednesday. I got 3 in on Tuesday and 1 in on Monday. This week, in front of me, I have daycare tonight, and I'm planning on attending unless the cold gets crazy again. But and then there is maybe a watershed that I may need to go to on Friday, because it looks like he's asking for alternates and appointees both, so we'll see. I may go down to it anyway. Other than that, that's all I have in front of me this week.
yeah.
We got
Dave is here.
Clark is
No,
here.
that's
Oh, Clark is here.
Yeah.
Yeah, do we wanna do one more before he gets prepared, or? you wanna do
I
yours?
can, mine's gonna take a little while.
Okay, then we'll just wait. Morning, Clark.
We'll get them in and get them out so we can get
So
going.
you
Yeah,
get going,
yeah.
yeah.
Okay, with that,
You made it.
yeah, we'll go to the Wellmark Blue Cross Blue Shield, and Clark is here to give us the update. You can sit right down, Clark, we'll get you in and out of
All
here.
right, that sounds good.
Get you down the road.
I have an incentive to talk fast today.
I think the quicker you can get 30 miles east of here, the better off
I
you'll
think
be.
you're right, I think you're right. Well, it was raining hard in Des Moines when I left this morning. Saw some lightning.
Yeah.
Yeah, they said it was a thunderstorm.
I saw
Yeah.
lightning when I came to work.
Good news, Clark?
I do have good news.
All right.
Excellent news, Clark. You set the bar pretty high last year.
It's better than last year.
Wow.
Well, at least
Holy
my
cow.
piece of it is. How's that sound? We'll cross that next bridge here when we get to it. Yep. And I have some Blue Distinction Total Care binders here that, for that meeting that you were invited to. Courtney,
Yeah, I know.
they're there. I'm gonna leave those with you.
Perfect, thank
We're
you.
gonna talk about it here today.
Okay, with that, we'll turn it over to Clark.
Okay, well, thanks. Again, this meeting's for you guys, so stop me with questions. But I do have some pretty good news. Claims are running really well. So you had asked, I think, a year or so ago, do you ever get a decrease? Giving you a decrease,
Wow, good, Clark.
okay? But we'll talk about that. The first part of this is we're gonna go through some reports that kind of shows you how the last 12 months has gone. Talk about some large claims, talk about the renewal. I did also provide a couple alternates. I know you currently today have your medical, or your RX paid through your medical, don't have a separate drug card. I'm gonna talk to you about that, and I did you a couple alternates to show you what a drug card would do for you, kind of protect you a little bit for the future, because that's usually one of our biggest concerns is the drug card. We have control over the doctors and the hospitals. We don't have much control over the pharmacists or the drug companies. So we'll talk a little bit about that as well. We'll talk a little bit about Blue Distinction Total Care. I know you guys participated in that last year. I think it did really well for you. I think that might have contributed a little bit to your decrease. McFarland Clinic is our ` ACO, and you're participating in that. The cost of participating goes up a little bit next year, but I think you guys have seen the benefits of that, and we can discuss that as we go through. Sound like a plan? All right, let's go to the first section here, is that little stuff on your left-hand sleeve. This is just your your self-funded billing. Kind of shows you all your claims that are happening. This first page should be the current plan year. Shows you how things are going, total claims in the middle there. No stop-loss claims so far this year. You look at the second page, it kind of shows you. Now, when you look at this, we go off of our max rates that we suggest to you. You guys set your rates accordingly. But if you set it on a max rates, you should be receiving, or you should have just so far this year, a couple $100,000 extra in your bank account. We're running better than what we expected. And the third page in is actually last year's contract, so it continues because of your stop-loss contract. So in the middle of that first page, you should see stop-loss credits. You can see that you've had quite a few stop-loss credits, totaling of $150,000. You look at the next page, still shows you, and this is why you're receiving a decrease, is that surplus or deficit. You should be seeing a little balance of your checking account grow or your account grow. So if you were charging the max rates, it's about $500,000 less than what we would have suggested you to charge your rates at. And I know you're somewhere in the middle there. You're not charging the max rates. Correct?
Correct.
Then the last page is this 2-year cost summary. I should print this off just to kind of show you that middle column. You see the pharmacy rebates with our move to CVS Caremark. You are receiving some pharmacy rebates on part of your plan. Some of your plan is still paid through the medical, not running through CVS. You can see that there was a pretty good sized rebate in August of 17. We did some auditing of CVS, and they owed us some back stuff, so that's why you see that a little bit bigger. As we tell people, you know, those numbers have gotten bigger. You don't want them to get too big. That just means you have more people using expensive drugs if you get some rebates. So, but you are receiving more rebates than you have in the past. And we've seen that on every group in CVS Caremark is because of that. Okay. The last one there is, you can see those are your large claims through this current process. So those are claims that are at least close to half of 50,000, which is your stop loss. see a couple of them that were, 150 and 90, and then you have a lot of them that are in the 20s and 30s that haven't quite reached the stop loss credit yet, and most likely won't. Any questions regarding that? We'll go through this. Tab 1 is some Blue Insight reports that I printed out. Kind of shows you, and I probably should have refreshed these, but these were, this does not have December information in here. So with my week delay, I probably could have refreshed these, but I didn't. For the fourth quarter, only has October and November, and does not have December. So this first page is your quarterly health report. You can see in the middle of that first column, the middle row there, talks about your total claims were paid. You were up a little higher in the third quarter and in the fourth quarter of last year, and you can definitely see a decrease as you're going to the right, going to the current period. Membership on the bottom has stayed pretty consistent. Looks like you're up maybe a couple employees. Oh, I guess you went down then back up again. Members have stayed pretty consistent, right around 300. The next page will break those down into office, inpatient, and outpatient. So you can see the office has stayed pretty consistent. Again, you dropped from the fourth quarter. You were a little high in the fourth quarter of last year, and you dropped. When you look at the bottom part of that, the paid per office visit has stayed pretty consistent as well. You had a couple months, maybe the second quarter was a little higher, almost $150 per office visit. Inpatient stay has done really well, and I think that's where you've seen some of the drop in claims. You had a couple inpatient stays in the third and fourth quarter of last year. I'm not saying that you don't have any, you just haven't had any big ones. Outpatient has gone up a little bit, so you've had some either surgeries, or we'll dig in a little bit deeper into that when we go to the next reports. Your ER visits has actually gone down a little bit as well, so you look at the bottom of that page, your ER visits have gone down. And Blue Distinction Total Care could have something to do with that as well. I don't know if Doctors on Demand, because I don't know if we had too many people signed up for that yet. Have you heard anybody? Because typically I get a report as long as we've had somebody sign up for it. And I'd have to use it, you have to sign up for it. I don't think I've gotten a report, so.
Well, I tried to, and then I wasn't using the right app, and then I didn't get signed up, so.
Well, we need you to sign up so
I
we can
will.
get a report.
I will.
Then you can see, if we're saving any, at least it'll show you how many people have signed up for it.
Okay.
You're not the only person I've told that to. So most of the people that in a couple other counties, I tell the auditors, make sure you sign up so at least I get a report. And we can advertise for that a little bit more too, and give you some flyers that you can send out.
Sounds good.
Okay? Pharmacy's running really well as well. You can see at the bottom of that next page, 3 of 3. Stayed pretty consistent, a little bit higher in the second quarter, really low in the third quarter. Generic utilization is doing very well. So you're right around our block of business of 86%. Paid per prescription has gone up just a little bit, and we'll talk about that here. I like to get somebody using a specialty medication. The next report is it's a pharmacy quarterly report. This first page basically just is what we just looked at. It shows you the cost of the drugs and the generic utilization. The next page, 2 of 4, shows you your non-specialty drugs. What I like to look at is the bottom of that page. You see the people that are using a brand name drug where there's actually a generic equivalent. That number, as you can see, has gone down. It was in the teens last couple quarters. 2 last quarter, and only 5 people currently using the brand name drug that has a generic equivalent. So that's gone down. Go to the next page. Let's go to 4 of 4. This will show you have somebody that's using a specialty drug. You've had 1 person, 2 people the second quarter. You have 2 people currently in this quarter using specialty drugs, getting a prescription a month, it looks like. And you can see at the bottom of the page what the cost is for those drugs. One drug was like $5,000. You've had some that per prescription $17,000. Why there is a negative for a member liability, I don't know. Look into that. The next report shows you people who are utilizing the preventative services, which is kind of, it's a new report. It's kind of nice to see how many people are currently using the free wellness, so you go get your wellness exam. So you can see that you've had 81 people that have used the free wellness exam. People are using the immunizations, breast cancer screenings, cervical cancer screenings. So they are using those ACA benefits that are available to them at no cost share. The next page will break it down. Yes.
97, the total people or the total events used could be a duplicate of people.
Which
At
one
the
you talking
bottom
about?
of
Page
preventive
1?
Services, page 104, yeah.
Oh, the 157? That is a total, and it could be a combination. It's not, one person could do this and have the other screenings, they're all added in there as well. So if you did your annual exam, you did a breast cancer screening, you're probably not, you're in there twice.
Okay. Those events.
Yes.
Okay, thank you.
And then it breaks it down, the next couple of pages kind of shows you how many males and members have used it and how many female members have used it on the next page. Obviously, every group is the same. You have more females that are using it, but you do have some males that are currently using it too, and that's good. We've had a couple you're at least using the colostomy or getting the, getting the screenings done. No one likes to do a colonoscopy, but it's needed. And then the next report is your annual report that we see every year. Again, stop me if you have questions. This is a little different time frame than what we were looking at before. This is the underwriting time frame, so this is a rolling 12 of November through October. And you can see on page 3 that you've kind of had the orange numbers are over there on your right as you guys, so you kind of had a little bit of a roller coaster ride, but you've gone down. We anticipate you to kind of stay a little bit lower and not have such a spike. You can see your trends have gone down for medical, gone down a little bit for pharmacy as well. Employees have, over the last few years have gone down a few employees. Page 4 kind of shows you your enrollment analysis. You have everybody located here in Iowa, which is your average age of your members is 38, almost 39. Gender, you have more males than females, about 55-45. And then when you look at total members, it actually flip-flops to 55-45. Then you go down to page 5, it shows you the distribution of your ages of your members. Your biggest band is those 56 to 64-year-olds. You still have quite a few over on that right-hand side where you see 15 of them that are over age 65. And you also have quite a few members that are in school, so 5 to 18. 35% of your contracts are single contracts. Then you have quite a few employee spouse, and you also have quite a few families as well. Next page shows your network performance. You're saving 43.2%. from what they bill us to what we have arranged with our providers. You can see on the bottom the network utilization. That number has gotten a little bit smaller, where last year you were 100% in network. You've had some claims that are outside of the network. Page 7 is always very interesting to look at. This is the claims paid by range. So it shows you in the first row going across there, you have 27 people, 27 members that did not use any claim dollars whatsoever. Which is good, because our benchmark is, that's about 7.8% of your group. Our benchmark is about 15, is what our average group does. So I think by seeing all those wellness things, you're seeing some people that are actually utilizing some of your benefits, and that's what we want. You go down, I go down to the 500 to 1,000, because your lowest deductible is 750, if I remember right. So I just kind of draw a line there, I add those up. So there's 208 members, 60% of your group that used less than about 5% of your claim dollars. Used less than $1,000. Go down a couple more columns to the 5,000, you have 85% of your group, or 295 members, that use less than $5,000. So no different than any other group. You have 50 people, you have 14% of your group that uses about 75% of your claim dollars. And hopefully those people kind of rotate around. Somebody gets better and somebody gets sick, and it's kind of what the insurance is all about. Next page kind of shows you who's spending your dollars. So when you look at the orange column is the current. So you can see you're having some spouses actually using a little bit more money than your employees. 5606. You can see those boxes on the top right of the plan's paying, almost 88% of the cost. The members are responsible for 12. That's just the nature of having a little lower deductibles, a little bit higher. Then below that, it kind of shows you, if they're outpatient. We talked a little bit briefly about that outpatient office where your dollars are being spent. We'll get into more detail of that as we go farther in this report. Page 9 shows you the squiggly line is where your membership is. Like I said, the 56 to 64 is where the majority of the people are, or your biggest age group. But you can see the 65-year-olds, and typically that's what happens, is they usually spend a little bit more money than the rest. But you don't have one of those, your green line is, your orange line is not like your green line, which is kind of nice. You haven't had any real big claims just so far this year. Then we talk about diagnosis categories. So this first one is kind of a generic, everybody gets lumped into what diagnosis categories, what allowed per member per year. You can see they've all kind of gone down a little bit. I mean, bones, muscles, and ligaments have gone up a little bit. Cancers have gone down a little bit. Otherwise, you can kind of see how things are spent. The next page will show you by age band. So when you look at the over 65, where it's a little bit higher, and typically this is the number that I see is those bones, muscles, and ligaments. Somebody's either had a replacement or some kind of a joint surgery. There's some digestive things that are going on as well. Typical for that age group. But nothing really jumps out at you. You can see that you must have had some, with the 56 to 64-year-olds, must have had some joint issues as well, or knees, or shoulders, or hips, or that's what usually happens when you get to that age group, which I'm getting closer to that age group. Then we're going to break it down by inpatient, just like we did before, but it's going to give you a lot more information. So inpatient just shows you that most of the time they're in there for surgeries. The next page, page 13, kind of shows you did have a baby. That was for a couple babies, maybe. It looks like the number of admittance for 1,000. did have, looks like on the bottom of that page, there was a mental health inpatient stay. So then it breaks down your diagnosis categories for inpatient stays. So you can see the digestive, and then you can see mental health was bigger than it was last year. And then you had some babies. Then the next one is your ER visits for that time frame. This one's a little more accurate. This is actually per visit, so 35 visits. The other one could be billed charges, so if the ER charges and maybe a radiologist charges, that could be 2 for the same visit. So you had 35, which is lower than you've had in the past. You were in the 40s. You can see the primary diagnosis codes for those ER visits. See if there's anything that maybe Doctors on Demand could, it doesn't look like it. Then we'll go to outpatient, and the same thing, they kind of show you surgical is definitely the leader of outpatient. Surprises through to medical, and you can go to page 18, shows you the diagnosis categories for those outpatient visits. And nothing really jumps out at you like, you see some ear, nose, and throat, you see digestive, some bones and muscles. But no numbers that are really larger than they were last year. The next page shows you your office visits, and most of those are all medical. You do have a few of them that were actually a little surgical, but not much. Page 20, I usually jump to page 20. It kind of shows me over on the box on the right how many people are using the primary care physician, how many are just going to the in-network doctor, and then it also shows me how many people are currently utilizing the chiropractor. So you have 120 claimants, and they visit the chiropractor 629 times for an allowed charge of $131, which $131 is a little bit higher than I normally see. So I don't know if the local chiropractor likes to hook you up to electrodes and massage you and do other things that charge more, but usually I see that in the 70s or 60s or 70s. I have some groups that are in Davenport right next to the college, and those fees are like $25 because they have lots of people over there that want your business just out of college. Then you have the office categories. For diagnosis categories, I really didn't highlight anything because everything's basically the same.
Finally got what he was saying, in Davenport.
Yeah, the Palmer, yeah, it's right next door to the college. They all come out and, yeah, I'll do you for $25.
Throw
Okay,
their
come on
shingle
over.
out and away they go.
Yep, exactly. Go to page 23. 23 shows me where you're going to the hospital. Also shows me what your top practitioners are. So you can see the local hospital is number one. A lot of claimants for the local hospital. Do utilize the hospitals in Nebraska, in Omaha. To go to Dunes. You can see the Mayo Clinic is down there on the practitioners.
What is the fourth one down there from the top?
I'm not sure what that is. It's probably something that,
emergency or something like that?
Yeah, it could be something that's,
It's in Idaho.
it's probably not in
Yeah.
Idaho, it's probably billed through Idaho. The owners might be in Idaho that
Okay.
own a bunch of different branches. And sometimes I can see, you know, but usually that's on the bottom if it's a, like, an air ambulance or something like that, but I don't know what, I could look and find out.
Yeah, it's no big
Do a
deal.
little more research.
It is an odd one, isn't it?
Well, the nice thing about it, I do have some groups on the top practitioners, the chiropractors actually listed there. You don't have a chiropractor listed there, even though you do have quite a few chiropractor visits.
There's a lot of them in town.
Oh, I'm sure there is. The next page shows you your pharmacy again, no different, it just, you look towards the bottom there, where the specialty allowed charge per prescription. And that just kinda stands out a little bit, and you can see a few years ago, you didn't have anything, and now you're in the 9 to 7, $9,300 per prescription. I've seen that on almost every one of my groups.
So what would that be?
We'll talk a little bit about your top drugs here in just a
Okay.
minute, but most likely it's probably the two drugs, Humira or Enbrel, that I see on almost every one of my groups. Then it just kind of gives you another analysis down below. You can see your cost is, the number of prescriptions has gone down a little bit, so that's good. Even though the cost keeps going up, but the number of prescriptions go down. Then the cost by age band over in the bottom left, you're a little higher in our benchmark on that 55 to 64, just because you have quite a few people in that age group. The next page will show you some therapeutic drug classes. You know, the one in the middle there says 48, that's for cholesterol. Again, a lot of 55 to 64-year-olds. Some antidepressants. Those are high on every one of my. First thing the doctor asks you, you've been feeling a little down or depressed, and so they're always looking to prescribe you something for antidepressants. The next page is your top drugs. So here you can see here Humira is on here a couple times. It is typically for rheumatoid arthritis, but it's also for Crohn's disease. It looks like you have it for both. The fourth one down is for ADHD medicine. It's for migraines. Crestor, you see Crestor in there, that is a brand name drug that's been around for a long time. We actually moved that to a tier 4 drug. What does that mean? It just means there's now other options. We call them low value drugs, we moved to tier 4. Now there's 6 or 7 generics for Crestor that are available, so we move it to a tier 4. And on a typical plan, we'll talk about that later when we talk about a drug plan, we set the copay a little higher on tier 4 drugs, so maybe it gives you more of an incentive to actually look for those generic drugs. You also have a few diabetic medicines, that Invokana. Chantix is a non-smoking medicine, trying to help you to quit smoking. But typically with your age group, you do see a few insulins in here, and you do have some.
Cialis.
Yep, Cialis is on there too. That's a tier 4 drug too. There's other options for you available, but Cialis is the one that's on TV. Any questions? If not, we'll go to tab 2. Tab 2, this first report here shows me all claims that are 10,000 or above for that age group or for that time period. Underwriting expects to have 20. You currently have 31 in this report. Last year you had 29. They expect to have 5 over 35,000, and that's what you have is 5. Those first 2 are the Humira drugs. Those are for prescriptions. So you see you have one dependent that's utilizing one of those. So that 4th column will show you if it's an employee, dependent, or spouse. And you see a few spouses that are in there using. So then I also ran a Blue Insight report with 10,000, a little different time period though. This is the current year, so this is January through November. It's still $10,000, but this will actually show you also if it's a employee, spouse, or dependent. It'll show you some diagnosis categories. When you see that NA on that first one, that means it's a drug. So far this year, that dependent has spent almost $29,000 just on medication. So then you see the plan member having doing the same thing. It looks like that might be the Crohn's disease. And you get lots of different diagnosis categories. They probably almost give you too much information. Nothing really jumps out at you.
On that one you were talking about, this first one, does that mean they're no longer on our plan?
That's correct.
Okay.
That's correct. So there's one. Yeah, there's one that looks like a rotator cuff, so there's probably some muscle, some bone things going on there. There's a baby delivery. But anymore, it does not take much to get to $10,000. If you have any kind of illness or you need to go outpatient or something, or a couple of prescriptions, you can get to $10,000 in a hurry.
Do you have a number on the percentage of people walking around with Hep C?
I do not. The number of prescriptions that we've seen has gone down. You know, I know you still see the commercials on TV. But the number of prescriptions that we've seen at Walmart has gone down. I don't know, they're talking, I think at one time I thought I heard there was a big percentage of middle-aged folks that have it in their system. I know when I go to Unity Point, and when you got my physical, it's one of the things they check when they do your bloods if you have Hep C. It's just kind of a standard thing now that they check. Kind of depends on your age group.
So in these wellness profiles, when they're drawing blood, is that what are they checking for those?
Most likely that's one of the things they're checking for
Okay.
too.
All right.
Then you can make that decision if you want to go and get that prescription to get that fixed. The one that we recommend is the most expensive one, you know, that's about $90,000 for a 3-month supply.
Well, and I remember you saying that.
Right.
You recommend that because the alternative is much more expensive.
Right. There's other drugs that we put at a different tier level or a non-preferred level that might only be $45,000 to $50,000, but they don't cure at the same rate. We don't want you to take that and then have to turn around 6 months later and take the $90,000 one.
Sure.
Just take it. It's kind of like some of the other things that we do. We talk about bones and muscles. You know, now they have stem cell stuff and stuff that you can do for your knees and hips and stuff. Percentage of that happening is still pretty low. I mean, some people have had some real success with that. That's kind of why we don't cover that. It's because we don't want you to spend $15,000 on stem cell, and then you realize, oh, my knee's still terrible, and then you end up going getting a replacement. You got to spend $60,000 anyway to get a knee replacement. So let's just go ahead and get the knee replacement done, because we know that that's going to be done, or work 85% of the time, instead of the stem cell stuff, so. Eventually that, maybe it'll come around, I don't know. That's kind of the thinking, same thinking. Good questions, though. Tab 3 kind of shows you what underwriting kind of throws together here. Talks about your enrollment, shows your claims. You can see at the bottom of that your claims experience is definitely improved. You're seeing a 24% decrease in your claims. Projected trend is still running at about 10%. So then the next page I put together, this kind of just shows you a little bit of a history of where you've been on claims wise. So you can see I went back a couple time periods. You can see your health claims as well as your pharmacy claims. Right in the middle of that page shows your lives or your employees on the top. You were in the 130s, now you're right around 120. You look down at the bottom, it shows you your admin cost. This is one of your, because your rate is split up in 3 different pieces. You have our admin cost, you have our claim cost, and then you also have the stop loss that you purchase outside of Wellmark. So the admin cost has gone up a little bit. It goes up, it's basically a fixed cost for everybody. You're the first one there, that $11.47, that is your network access fee. And that has gone down just a little bit, and the reason why that's gone down is just your utilization outside of Iowa has gone down a little bit. Because we look at, we have with the Blue Cross Blue Shield Association, we have a blue card that the other plans charge back to us. So less people going to Minnesota to Mayo, less people going to Omaha or to the Nebraska Blue. So that's gone down just a little bit. Our admin cost has gone up a little bit. So you see was $36.83, it's now $38.58. So it's gone up 4.75%. Your PPM access card fee has gone down, or it stayed the same. It was at 121, it's 110, now it's staying at 110. There's a little bit of a charge in there for using an outside stop loss vendor for doing some reports, and there's some margin there. Then you look at the bottom of that, you see those numbers of 72.23. That is where your claims are running. So what we expect, you're running 73% of what we expect. So that's the reason why you're getting a decrease, overall decrease. We want to get you more in line. We like you to run about between 90 and 100. So we want to get you right around there again. And then I put in the large claim information that I've seen in the past, like we just talked about, some demographic things on the bottom. So this is your current rate page, so it shows you where you're going to your total fixed costs. And then your overall suggested rates have gone down 4%. The suggested rates have gone down 4.31%, but when you add in the fixed costs, your overall suggested rates have gone down 4%.
Where are you at?
I'm looking here, but I have some notes here. So when you look,
Oh, okay.
the top part of that has gone up 4.58%. That's our fixed cost. Us managing or paying your claims, using our network, doing those kind of things. And then you look at the bottom part, that is the annual projection of claims. So even though it's a little bit smaller piece of a lot smaller piece of your total premium, it's gone up 4.8%. Your claims have gone down 4.31%, so overall it's gone down 4%. Then you have your stop loss too, that you need to add in there as well.
Did you quote that as well?
I did, and we'll talk about that here in just a second. And then I have all three of your rate pages. And if you go to tab 4 is your current plan designs. And there is a couple things that I wanted to look at, and I really didn't want to mix with the medical side of it. Except for you go to page 4 of 7. Maybe something here we might want to fix. When you look at, we did this last year, I think we changed this to some facet things. We changed the no limit on your skilled nursing facility. Right above that, it says the cost of blood is not covered. Standardly, what we were doing now, I mean, in Iowa, there is no cost for blood because everybody donates blood. But if somebody is in Nebraska or somebody's on vacation and they go and have to have a surgery done, some places actually will charge you back for blood, plasma, or whatever it is. So we're standardly are changing that to the cost of blood is covered through the plan. So that's something we might want to change, is to have it, just in case somebody's on vacation in Texas. I don't know what state it would be, but if somebody's there and all of a sudden the plan pays for everything else except for the blood, and all of a sudden they get this bill for $400 outside for the cost of blood, the plan might as well pay for that. No change in your projected rates or anything like that. It's just a convenience of those employees that might be impacted.
Can't imagine it'd be that much.
I can't imagine either. No.
I can't imagine blood would be that cheap.
Well,
$400.
it could be, once the ones that charge it could be, depends on how much you need.
Yeah.
You know, and they might charge you more for the rare blood than the other blood. I don't know, you know. So that's something we might want to fix. And then I also, I quoted some things. We'll just jump, and that needs to be fixed on all of your plans. So that's the one thing that needs to be fixed. Then you go to tab 5. This is where we actually quoted some things here. Now, is your current stop loss 35 or 50?
50.
Okay, well then I got the wrong number here, but it's still, no matter what, I
I
think.
bet you could send us one.
Yes, I can, but it's still gone up. So this is, I ran a plan design change for your 750 plan as well as your other plans. I did do a stop loss change, or quote, and I need to change that to 50, your current, and it's 2412. Is that the right contract? I better make sure I get that right too.
Or where you,
You know, if that's what you need to find out what you got for sure, and then let me know currently, so we
that I
won't
don't
match
know, I guess I've never
apples to
been asked
apples.
that question.
What that means is that those are claims that are incurred for 24 months and paid in the current 12 months, or you can have them paid outside. The way those reports read at the beginning, looks like you probably have them paid outside, so there's some lag. So it's probably a 12/18. I need to find that out for sure. We might
That'll
order.
show up on the HM thing, won't it?
It should, yes. But needless to say, I did run this just like I did last year, and the cost of this has gone up. I did talk to underwriting, and underwriting said that there was a new claimant that's happening in December that you're gonna see continue. That's gonna probably have an effect in your stop loss rates when you get those. So I'm gonna quote the same thing, make sure that we're apples to apples, so you do have those, you at least have something to compare to. Because I think last year we did the same thing, we were looking pretty good, and I think they might have came back just a little bit better than we did. So I'll verify that and we'll get that done, but it's gonna have an impact to your rates. Because they anticipate that claim to kind of keep on going, and I think you're probably aware of it, so. But the next page here kind of shows you what I did with the 750 plan. This is kind of a nice little spreadsheet that shows me what I changed. I left the medical piece, which is up above, the same. What I did is I changed the RX. So you're currently the 750 plan. The 750 plan is being paid under your medical, so I put it into a drug card. So what's that mean to the members? Well, today they have to meet a $750 deductible before they get any drugs. They're gonna get their drugs a little bit faster. but we're also gonna be able to manage what they get, or have some kind of a carrot stick kind of thing. So when you look over here on the right where you see the yellow box, I made a generic copay of $5. We want people to use that $5 generic copay. The second tier is $25, that is for a brand name drug. $50 is tier 3, that is for non-preferred brand name drugs. There's still some of those out there. And then tier 4 drugs is where that Crestor comes in. No, those aren't specialty, those are just those drugs that have been around a long time. There's other options. We moved them to tier 4, so Crestor would be the one that would fall into that. Cialis would be another one that would fall into that. So that's a $100 copay. What's that do to somebody? Makes you go talk to the doctor and find out if there's something else you can take that's cheaper. And then I went down, and you can see at the bottom of that yellow box, that's where I put in the specialty copays. Today, once they meet the $750 deductible, they pay a co-insurance, and then those drugs are paid for. This is it's gonna get to the same thing, but it's gonna be a little bit easier for them, but it's also gonna steer them a little bit. You see the difference between 100 and 200, that is preferred, non-preferred. This we talked briefly about, we kind of place them, and those drugs are not only always the cheapest, but they work the best. So the 100 is the preferred drug. We want you to use that specialty drug. Humira is one of those. It works good. There's other drugs that don't work so good that we want to charge them a little bit more, or steer them back to the preferred side.
So if somebody was on Humira, they'd have to meet their out-of-pocket of $1,500 before they would start paying the $100 per.
Today, they pay that $750 deductible, and then they would pay co-insurance, 20% co-insurance,
Up to
up to $1,500. One prescription of Humira is $7,000. You'd pay that $1,500, and then you would get it paid for.
Okay, and you're proposing?
I'm proposing that we go to a drug card, so we can have some better management. For one thing, it goes through CVS. We can steer them around with the tiers. Typically, it's steering the doctor around and not so much the patient. And then doing the specialty, and you look at the bottom box there, you can see that the yes says yes and it was no before. That also is our specialty pharmacies. So we have a contract with Hy-Vee Specialty Pharmacy and CVS Specialty Pharmacy. Those are our two prescriptions. We would limit them to have to go through those pharmacies to get their specialty drugs. What's that mean to you? You're gonna get a little bigger of a discount. They're gonna get a little bigger of a discount. They're also gonna get some additional care management too, because those folks only deal with specialty drugs. And that usually only affects the doctor, because the doctor prescribes those, he sets that up, he would see that, call one of those pharmacies, they would work with the patient to get it either delivered here to their office or to get delivered to home. It's something that you can't usually go to the Walmart and pick up. It's usually something that has to be delivered to your house.
So, let's say they made that change. and
Yep.
January 1st, the person goes to get their prescription, beginning of the new year, haven't met my deductible. Do they have, if you make the changes, do they have to meet their deductible, or do they pay the $100?
No, they would have no deductible on the medical. We have no deductible set up here. A lot of times what happens is, I didn't know how to set it up for sure, but a lot of our plans will have a $100 pharmacy deductible. So they'd have to meet the $100 pharmacy deductible and then start paying their copays. Right now, I had nothing there. It's just, we're gonna incent them to go.
So is it gonna
So,
save
so
money
that,
if
so
they're
then,
not paying the
so then
$1,500?
the $100 deductible would go towards your $750.
Okay, I see what you're
The
saying.
cost of this to the plan actually goes up a little bit, because people are gonna start getting those drugs a little bit sooner. But again,
Ultimately, it would cost the employee the same.
it's,
It's
yes.
just that they don't have to come up with it
It's
all
gonna
at
be,
once.
it's gonna be better for them, you know, they're gonna get it a little bit faster, they're gonna start getting their $5 prescriptions. So that's why it goes up a little bit, but I think over time, we're gonna be able to manage them a little bit better.
So what's the big benefit for Walmart, just to manage those drugs?
We wanna manage those, you know, those drugs, yes, get CVS involved. Having the different tiers right now, it's just the pharmacist, the doctor can prescribe whatever he wants, he knows that they're gonna pay a maximum of $1,500. they're still gonna pay the maximum of $1,500 here. It's just gonna come out $100 at a time. Where the person that's using Humira today, the first prescription, they're probably coming up with $1,500.
Whereas if you made the change, they'd be coming up with $100.
They'd be paying a little bit less, yes. But over time, they're gonna be paying the same, but we're gonna try to steer them in the right direction. And I know I had sent you an email regarding the opioid
Yeah.
management. That is kind of still on the changing. I think it looks like 4/1 that's gonna come into play. We're gonna, under our utilization management, under our pharmacies, opioid management is gonna be part of that. What's that mean is today, when somebody gets their shoulder done or their knee done, you get a 30-day prescription. Majority of those people use about 5-6 pills, and they still have 25 pills sitting in their cupboard. We're gonna manage that. The doctor has to give more reasons to have more than a 7-day prescription. Otherwise, we're only giving them 7-day prescription. So if somebody currently is on Vicodin because of their back, to kinda, I can't work without it, you're not gonna be affected. It's the doctor, they're gonna prescribe those going forward to somebody new, you better give us more medical reasons why. Because we're gonna try to, and I think it's gonna happen not only with us,
Yeah.
everywhere,
Yep.
they're gonna try to manage how many of those pills are out there today, because they said there's, everybody, I know I had knee surgery 6 years ago, had my knee scoped, and I think I still have some of those things in my closet too.
Yeah.
Yeah, you
That's a lot. I think that's a lot of people.
Yeah, they probably do.
You keep them in case you might need them.
Right.
And
For
then-
whatever.
yeah,
Right.
Then you forget they're there.
Yeah.
Yeah.
So, I mean, that's gonna happen through CVS as well, so that would be another benefit of doing this.
And this would be just strictly on specialty drugs.
No, this would be for, this would be moving everything through CVS, Caremark, every drug, even the generic drugs would go through there.
So let's say locally here, so you would have to go.
No, that doesn't matter. I mean, we're talking, the specialty drugs is the CVS or Hy-Vee, correct?
Okay.
Otherwise, you still use the same pharmacy for
That's-
your,
okay, that's
for your
what I was
brand
getting
name
at.
drug or your Lipitor or whatever you need to take.
Mhm.
No change there.
Is anything gonna change there?
No, it should not change, no.
My daughter is on I pay $1.45 a month for her medicine. Now, if we switch that, would I be paying $5?
Nope, you'd be paying the lesser of.
The $1.45.
Mhm.
Okay.
Yeah.
Yep. But you look at the bottom here, the rates do go up just a little bit, about 1.9% if you change it on this plan, the 750 plan. And
And
then-
that's already the way the 1,500 set up?
That is correct. So the only thing that's a little bit different on the 1,500, you go to the next one, so a couple pages over, is the $1,500 plan. The $1,500 plan currently has 3 tiers. So I would move in to put a 4th tier in there for the $1,500 plan. Maybe you want to keep it off. Maybe I got it in the wrong order. No, 1,500 is it?
Looks like the same thing. Got your copy of the same one.
You
Same
do?
numbers, yeah.
What about the next one? Susan. Maybe that's why we had some extras.
Yeah, I see, and then I see this must be the HSA.
Yes, yep. Okay,
Let's see.
I apologize for that. You all have the same one? The exact
Mine
same
is-
one?
mine is
Oh, you
the way
got the
it's-
right one.
Yeah, I
Mine's
got the right one.
Mine's right.
So do you have it, so the boxes are on both sides where you can see?
Yeah. These guys.
Okay.
Yeah.
I don't know if
Well, I
Neil does.
apologize, we'll get that fixed. You can have mine, once I'm done talking about it, how's that sound?
What about me? Yeah, you could email me one.
You have a coin, we can flip a coin?
Oh, you could email it to me.
But what this is your current plan design. So the current plan design, you do have a tier 1, 2, and 3 copay. So I wanted to introduce a 4th tier copay. I did not change your this has a separate deductible or separate out-of-pocket for your pharmacy. What I did do is I did fix the specialty pharmacy. So I left those the same, except for I had added a $100 tier 4 copay. and into the pharmacy, and your rates will go down about 1.3% on this plan. So it's only gonna affect the handful of people, and I've had several groups that I've done this to. What we do is we will run a report to see who's using a tier 4 copay or drug today, and we would let them know, we would send them a letter telling them there's gonna be some changes going on. So if you're currently using Crestor, your copay is now gonna be $100. We will let them know. So a month in advance, hopefully you can call the doctor and say, hey doc, my plan's changing, is there anything else? Now keep in mind, every tier 4 drug, there's another option, other tiers. Also, if you've done Crestor and you've tried those other drugs and it makes your heart rate go up or it gives you a rash or whatever it is, the doctor can fill out an exception form and we can get that Crestor covered at a tier 2 level. The doctor will do that, but if you just say, I like the purple pill over the white pill, sorry, there's going to be no exception for that. But if you truly have a medical reason, the doctor can fill out a medical reason to get that changed, yes.
Back up, you said this policy goes down 1.3?
This one was, yes.
What was the first one?
The other one goes up,
One-
1.9, I think.
That's what I thought, okay.
But this one already has pharmacy in there, so we just added the tier 4 and the specialty, which especially is kind of being the bigger deal at the moment. Otherwise, there's no incentive to do anything over here. You just, whatever drug they want to prescribe, you take. And then I did the same thing to the high deductible health plan. All I did here is, because everything's being paid until you get the deductible, all I did is I limited the specialty drugs into that specialty pharmacy, and it's roughly about a 1% decrease. So it's only gonna impact those people that are gonna do the specialty pharmacy.
What tab was the drug listings?
It was on tab 1.
Okay.
And kind of towards the back, yeah, it was on page 27. So you can see the specialty drugs, there's 3 of them there, they're all Humira. Yeah, I got a plug by while I looked outside too, I wanted to see what was going on. Scooping off some hail. Sleet or whatever that was this morning.
It's a mixture, I think.
Was it?
Hurt when it hit
I
you.
really didn't see it until I got to Coon Rapids and I saw it.
Is Crestor I don't want to say a continuous use drug.
Yeah,
I'm
it's
using it.
it's a maintenance cholesterol medicine,
Yeah.
like Lipitor.
Right.
Lipitor kind of was the same thing, and then now they have all the generics for Lipitor. But Crestor, there's still some people that are using Crestor, and now they have different generics for Crestor. At a fraction of the cost.
And like you said, if people have issues and need to use Crestor for medical reasons.
If they
can
do,
get it
if
at
they,
tier.
if we change that, if we notify them that they're gonna move to a tier 4 drug and the copay's going up, they talk to the doctor and, doctor, we've tried these other drugs. They can fill out an exception, CVS can grant that, and we cover it at a tier 2 level, the brand name. I have some groups that are actually going as far as eliminating tier 4 drugs, so no longer covered under your plan. If you wanna do it, you pay for it on your own. So most of them that don't have a tier 4 copay yet, I don't recommend going as far to eliminate the tier 4 drugs, but at least kind of steer them back to the doctor to get a lower level, or if they really want to use it, pay $100 it. And I will fix this stop loss to 30 to 50.
And I'll look and see what-
Yeah, find out what the contract is. I will find that out as well. See if I know what they were.
These are the top 20. How many other drugs are we using, you know?
Oh,
Are we using?
there'd be quite a few on that list.
I don't see Embro on here.
Yeah, I don't see that either. If you had it on there, it would be, it would show up because Humira and Enbrel are number ones and twos. About
Mhm.
$35 million a year Walmart spends on those two drugs. And I know there's some cholesterol medicines coming there. There's some insulins that are gonna come in a tier 4, or excuse me, not a tier 4, but a specialty level. Not saying that we don't want you to take them, we just want you to get them from the right spot where we can manage them as well as, give you a little bigger discount, give the member a little bigger discount. Because right now, there's no steerage except for you go, the doctor will order through wherever, and it looks like they're ordering it through, when you look at the top, we look at the top providers, the pharmacy, well, it says pharmacy provider, it does not tell me what it is. So next year, that would, instead of saying pharmacy provider, that would say either probably Hy-Vee or CVS, and hopefully that number will be a little lower, we get a little bigger discount.
How effective are urgent care clinics?
They are effective as long as, depends on their hours, how long they're open. This time of year, especially with the flu going on, you can sit there for a long time at the urgent care. But most places that have them, that are extended hours on Saturdays and maybe Sundays for a short period of time, they see an advantage of having that, and that's probably why you see a little bit of a low, your ER number has gone down a little bit. What time's the clinic open here on weekends?
Me, on Saturday mornings.
And it's
Yeah.
open until 7, I believe.
Well, urgent care might be, but like the regular clinic is only
Okay.
open like in the morning.
Is urgent care
I
in the
guess they're-
hospital or?
Urgent care, I think,
Okay.
opens
McFarland
early.
Clinic.
Okay, yeah.
And urgent care has early, they're open earlier and they stay later. So there's those hours that,
So it's has to be much more beneficial to go to urgent care than it would be.
Oh, absolutely.
It's emergency.
Absolutely. Now, our next topic is gonna be Blue Distinction Total Care, and the McFarland Clinic is your main ACO, or health organization that's part of the Blue Distinction Total Care. And they have an incentive to keep the costs down, so that's probably why they wanna send you into the urgent care or have those hours open, because it benefits them if you come see me. Not only I get to make some money from there, but I get to save some money because you're not going to the hospital and it ruins my score, that the cost of care has gone up a little bit. So McFarland Clinic is by far, not by far, but is our #1 performing health organization for Blue Distinction Total Care. And that could have a little impact on what's going on with your claims too.
Clark, are we in